In this part of the intervention, we will be using 4 assessment tests to identify the nurses that are at risk. In our intervention program, we will use a 4-dice online questionnaire that assesses current happiness. Aside from assessing a person's well-being, it will also identify a person's reported pleasure and examines the affirmative aspect of subjective well-being. The next questionnaire is CESD from Radloff, 1977, and is a self-report depression scale that will help us measure depression symptoms among the nurses at risk. The next scale that we will be using is the Brief Resilience Scale, and this questionnaire by Smith 2008 aims to help individuals assess their own levels of resilience. The test asks individuals to choose to agree or to disagree with 6 statements. Last but not least, we have the Hamilton Anxiety Rating Scale. The questionnaire by Hamilton 1959 main purpose is to assess the severity of anxiety symptoms. Our intervention is called Relax, Reflect, and Evolve, and it will take 15 days to complete the intervention. The participants will be taking the first assessment test mentioned before. Relaxation techniques. The first part of the intervention asks the participants to do deep breathing exercises or techniques at the start and at the end of their shifts at the hospital. Diaphragmatic breathing, also referred to deep breathing, is a method that is based on the idea that relaxing the body eases the mind. Now we're going to proceed to the instructions of deep breathing. First, you're going to choose a spot where you can sit and feel comfortable. Then you're going to locate the timer on your phone and set it to 5 seconds. Then you're going to place the palm of your hand on your stomach and breathe slowly and deeply to your nose and hold your breath for 5 seconds and then let the air out slowly. Repeat it for 5 minutes before and after work. There are several different approaches to muscle relaxation. In this intervention, we will be focusing on applied relaxation. Instructions. Muscle relaxation begins with the dominant arm and inhale while contracting the muscle groups there. You can do this by imagining that you're squeezing an orange in your palm. Hold for 5 to 7 seconds and now release the muscles and focus on the feelings of relaxation for 20 to 30 seconds. Repeat steps 1 and 2 with your non-dominant arm, shoulders, jaw, thigh muscles, glutes, etc. until your body has relaxed. Our next technique is cognitive reconstructing, and is a form of positive psychology technique. This technique has been successfully used to help individuals change their way of thinking. The goal of this technique is used to alleviate the stress in one's life and replace the stressful thoughts with more positive and relaxing thoughts. Instructions to cognitive reconstructing. Maladaptive thought. I don't have any support. Reframe thought. I'm learning to function independently. Maladaptive thought. Everything is so new that is overwhelming. Reframe thought. Everything is so new that is exciting and I feel overwhelmed. The participants will be encouraged to retake the 4 assessment tests after completing the 15 days of the intervention in order to determine whether the intervention was successful in improving the participants' coronaphobia. As a follow-up, we suggest focusing on increasing the participants' resilience. Since we will already have evaluated the participants' level of resilience, it will be simple to determine the strategies we may use to increase their strength. Thank you.